I want to really thank all of you for coming to hear about this very important topic of child sexual abuse, about the importance of focusing on prevention, not just treatment or incarceration, and the importance of federal funding to build the science of what works in preventing child sexual abuse. Child sexual abuse is highly prevalent in our country, more prevalent than most people realize. It spans across socioeconomic, racial boundaries. It is a problem in every community. The consequences are dire for children, for communities, and to the whole country. There is a lot happening at the state level in policy around child sexual abuse, and this is part of the disconnect. We have a law called Aaron's Law that's focusing on states doing prevention work, but it's a very specific requirement about what prevention is called within that law. To say that half the states in the country have a law that says you need to be doing something around child sexual abuse prevention, yet we lack a scientific base for what really works in this field is really the disconnect we're going to be talking about today.
By the time I was 4 years old, I had 3 sisters. I had a mom who was a drug addict. We were taken away because of abuse and neglect. I was thrown into a foster care system in Missouri and Illinois, 13 homes, constantly changing, bouncing around with nobody to depend on, and no steady family or friends. But see, that suffering and neglect made me the perfect child for a specific type of individual. And so I was finally told I was lucky that I was going to be adopted. My adopted father, Tom Wilson, was a kindergarten teacher. He was a Cub Scout master. He was a youth minister. And you guessed it, he was a pedophile. So from 9 to 15, my life went from being very difficult to downright hell. So I'd never had a father before, so I didn't really know what the definition of affection was. It started by just peeing in the same bowl or having sleepovers. And it escalated till I really noticed it wasn't right. And at that time, all pretense of affection was gone. It just became a form of punishment. And after the physical abuse, the sex abuse would always follow for the slightest mistake. And until I was 16 years old, day in, day out, for years on end, until I was old enough to leave.
What we're learning over the past few decades suggests that experiences such as child sexual abuse can have lasting damage to the most basic levels of our nervous system, our endocrine system, and our immune system, making people who suffer from this experience more likely to suffer diseases throughout their lifetime. We have a vision at CDC for addressing child abuse and neglect, including child sexual abuse. It's about creating safe, stable, and nurturing relationship environments for all children. But in order to realize this vision, we need better science. We need a better understanding of this problem. We need data to identify and help us understand where we are so we can map out a strategy for where we want to go, and we can monitor it over time. This is really important underpinning for prevention. And that type of system still needs to be developed and implemented. We do a lot of research in public health on risk factors, but perhaps more centrally important to prevention is understanding what protects people from becoming perpetrators. What is it in families and communities in society that can offer a protective environment for children that prevents them from developing these behaviors? And finally, we need a better understanding of the community and societal risk factors that contribute to child sexual abuse. We understand much more about individual factors and factors in families than we do about how broad social norms, broad social factors, how community structures influence child sexual abuse, how norms around and beliefs around male sexual entitlement, for example, contribute, and how can we influence that?
Georgia is one of the newest states to implement an Aaron's type law, and that requires schools from kindergarten through 12th grade to provide annual child sexual abuse prevention awareness to their students, to provide some professional development for teachers and also for school staff, and to require that in-service training be provided to school staff on an annual basis. If we had some federal guidance or some research-based, evidence-based that we could utilize to say, these are the most effective programs, this is what would help the situation the most, that would be very helpful.
Today, there are more than 16,000 adults in federal prisons for sexual offenses. It costs $32,000 per person per year to house someone in a federal prison. This means that annually, we spend $512 million incarcerating sex offenders in federal facilities. Designating massive resources after sexual abuse has already occurred and almost no resources to prevent abuse is a choice. Children are harmed by this choice. We are all harmed by this choice. So why do we do this? Why do we put nearly all of our money, time, and effort into punishment and so little into prevention? It takes federal resources to build a comprehensive approach to child sexual abuse that includes effective prevention efforts. That is why we are asking for $10 million in new federal funding to go to the CDC to support the thoughtful development and rigorous evaluation of child sexual abuse prevention programming. It's easy to say that we don't have the money if we don't believe prevention works. 30 years ago, we began taking a prevention approach to every other type of childhood injury and illness. This includes child physical abuse, child neglect, bullying, peer-on-peer violence, and adolescent suicide. Yet because we choose to believe that child sexual abuse alone, among all types of childhood victimization, is somehow not preventable, is somehow uniquely not preventable, we do not invest in its prevention. This is not a partisan issue. This is not a divisive issue. We all agree. No child should have to experience what Delegate Wilson went through. No child should have to experience sexual abuse of any kind.
Each time I jump this deep to talk to you, I worry that I'm never gonna be able to climb back out. Good thing to say, I know I'm nobody special. There are millions of people like me. I know that sometimes you don't get to be the great difference maker. You don't get to be the next Martin Luther King or JFK, but you may get to inspire them. So if I can motivate individuals to keep fighting, or just remind some of you, even in the audience, that you're not alone, not to give up, then it is worth it. And for the very last thing I do on this earth is open up the eyes of our federal government of the true and lasting horrors of child sex abuse and help promote some federal intervention and research, because it can be prevented. If I only do those things before I pass, then it is well with my soul. Thank you.